All right. Hello, everyone, and welcome. I would like to introduce DOBARA. I am Samin Ansari, and I am the creative director at DOBARA. DOBARA is a nonprofit network of volunteers from all over the world, comprised of all age groups, all focused on senior well-being and promoting healthy, active aging. When we speak of well-being at DOBARA, we include emotional, mental, and social, along with physical well-being, because all of these together are components that make up the quality of our lives. At DOBARA, what we do is based off of the science of gerontology and a collection of best practices gleaned from several studies from around the world that have researched and delved into what makes a healthy and happy senior citizen. Dobara in Hindi means once again. And over the past 7 years since its creation, Dobara has been constantly growing, adapting, and evolving. In our own special way, we are creating our own blue zone of contented longevity through our senior well-being network that empowers and encourages our members to flourish and thrive as happy senior citizens through life after retirement. We currently have about 250 members following our innovative and creative virtual well-being program. And our strength lies in all of our volunteers. So today's session is part of this virtual well-being program. And this year, we are doing a special spotlight on caregivers and caregiving. Dr.Ashank Mishra is a volunteer who has very generously volunteered his time to share his knowledge and insights today on caregiving tips for caregivers caring for people with neurodegenerative illnesses. This is part of a 3-part series. Last week, Dr. Ashank walked us through some misinformation and myths linked with dental care. We will have that video up on our website, so you can always go back and watch it. It was very, very helpful. And the one next week is going to be more centric on certain illnesses and dental care. I'm going to, I mean, it's a little bit hard for me to do an introduction on Dr. Ashank because he has so many achievements and accomplishments. So I'm going to try and keep them brief. To begin with, Dr. Ashank is currently based in Hyderabad, India. He did his MDS from NTR University of Health Sciences in India, but then he continued, and I feel like he studied all over the world and his knowledge, encompassing his knowledge. He's studied in Vienna, he's studied in the US, and he's also studied in Glasgow. Currently, he is a visiting professor in the Department of Periodontology and Research in EIMS-HEI Malta. He's been awarded under the category of Excellence in Periodontology and Laser Dentistry by the International Exemplary Research and Performance in 2018 and 2019 consecutively. He has a multiple number of things going on, and he has a clinical practice in periodontology, laser dentistry, and implant surgery in Hyderabad called Dentaldontics Family Smile Care Center. I will put that information on our website, so anyone who would like to consult him privately would be free to do so. With this introduction, I will hand it over to you, Dr. Ashank. Take it away.
Yes. Thank you so much for such the introduction. Thank you very much. And good evening, all my Indian friends, and good afternoon to all the European friends who are there all over the world. I hope my voice is very clear and audible. Yeah. So I begin my session 2 with Dobara. As Samin has rightly said, Dobara in Hindi in India is once again, or the second time. So it has got a very important integral meaning when you actually look into. And we will go through very, very important tips for oral hygiene, which caregivers should be aware of whenever they are into the management of the patients with neurological disorders. Okay, so the most important thing is the tips which I'll be giving all throughout the presentation is for the caregivers, and also some tips for the dentist as well, so that they can manage the patients with neurodegenerative disorders at ease. Now, before that, we try to understand the progression of a neurodegenerative disorder. Now, you need to understand what do you mean by neurodegenerative diseases. Neurodegenerative diseases means the diseases which broadly falls under these conditions is Parkinson's disease and Alzheimer's disease. Now, this picture actually is a very conventional picture which shows the progression of the disease, where you can see how the progression of the disease from green to yellow to red trees, they lose and shed. That's how the memory or the neurological matter of a patient or of an individual degenerates with age, with aging, or with the disease. Eventually, you need to also understand that why are we discussing it when concerned to oral hygiene tips, and how important is neurological diseases with the diseases of mouth, or which I should say periodontal diseases or gum diseases, which I mentioned in the previous webinar as well. You all know very well that Parkinson disease is a disease which happens with aging, and it is a disease which basically happens when one of the center of your brain, the neurons of your brain, which are responsible for doing movement or motion, are having, or they lack secreting something called as the dopamine. You would have heard of what is a dopamine. It's a neurotransmitter which actually helps for the motion or movement of a person, of an individual. So Parkinson disease is something which actually initially starts with a little tremors in a hand or maybe in a finger or your foot. It increases to rigidity of your arms, of your extremities, goes to a very higher level where you have typical rigidity, slowness of movement, the tremors are there, muscle activity becomes absolutely high enough, speech difficulty, articulation problem, chewing problem, mastication problem, affecting the patient's physical and mental well-being, and patient goes into depression. That is something very common which happens eventually with Parkinson's patient. Alzheimer's disease is one of the major diseases which causes dementia, which starts from a mild memory loss, eventually goes to a major memory loss where the individual is totally dependent on someone for its activities. It's basically causing dementia eventually. So these are the two conditions which broadly come under neurodegenerative diseases, which I will talk to you about in the today's session. These are the dental conditions which we notice in these type of patients. It starts from a dental decay. You all know what dental decay is. Decay. Periodontal diseases or gum diseases, which I mentioned you. Then there's something called as drooling of saliva. These patients may sometimes have excessive salivation in their mouth, where the saliva drools out, which is called saloria technically. Then dry mouth. Some of the patients also suffer from dry mouth. That means there is no saliva in the mouth, or very minimal saliva where patient feels dry mouth, which actually doesn't happen because of the disease. It actually happens because of the drugs which patients are taking, and those side effects are causing dry mouth. Some of the patients may notice orofacial pain. That means the pain all around your face, your mouth, and inside your mouth, including your tongue and cheeks. You feel burning mouth syndrome. You feel burning mouth. Mastication disorders, as I said, chewing disorders, difficulty in chewing, especially in Parkinson's, because of the patients having a lot of tremors. Because of that, you have your insufficiency, your motor insufficiency increases. Because of the cognitive disorders, the problem happens. Patients with a lot of anxiety and stress will land up into teeth grinding, which is called as bruxism, where they have grinding of teeth, which happens in night grinding, which is called as very popularly. Subjective taste impairment sometimes, and I will talk about what are the dental treatments and the maybe the management of the dental treatments by a dentist itself and sometimes by a caregivers as well. Now, something which is very important is this is a picture which shows what exactly I mean by teeth grinding. Teeth grinding means the clinical picture appears something like this, where your teeth, if you notice that the height of the teeth is reduced, the upper part of the teeth, the enamel is almost worn out, and you can see the inner part of the tooth. That means because of the grinding between the two teeth, the outer layer of the teeth is worn out, and then the patient starts getting a lot of sensitivity and pain, sometimes jaw pain, soreness of jaws that also happens. And this is all sometimes because of sleep disorders, anxiety, or stress, or maybe a dental problem also. And this is also something very common which we see in neurological disease patients. Now, when I talk about gum disease, I think the gum disease has got various stages. I need to understand that gum disease, as I said last time, is 90% prevalent globally. Everyone has gum disease. It starts from basic gum disease, which is gingivitis, to a higher level of disease where your tooth becomes loose or mobile, which is called as periodontitis. You can see a picture which shows the healthy tooth and a diseased tooth. You can see the diseased tooth also there. This is a clinical picture which we see commonly, which shows the bad state of gums, and this is what happens. You can see all over the plaque, you can see so much of tartar, you can see bleeding, you can see gum swelling, you can see clinically. These are the conditions which happen in a moderate to severe gum disease, which patients land up into when the oral hygiene is lacking. When a patient's oral hygiene maintenance is bad, patient's saliva content is less, there's no lubrication in the mouth, there's no moisturization in the mouth. What happens basically? The tartar gets deposited, the gums get swollen up, and eventually the teeth starts becoming mobile or start becoming loose. So this is what is the fate of a gum disease. As I said, gum disease has got 4 stages, and these are the 4 stages which happens in gum disease. So from a healthy gums to an advanced periodontitis. So what happens in the last, as that you lose your tooth, the tooth becomes mobile, you get bad breath, and so on and so forth. Now, the most important concept here I would like to introduce, this also I covered in fact in the last session, that oral health is equal to overall health. So oral health, the gum disease, especially when I talk about oral health, I'm talking about the gum disease. It is very, very common that when you have a severe amount of gum disease, the gum disease not only is restricted or to per se to your mouth itself, but it spreads all over your body. It spreads to your blood vessels. It goes to your brain, where you have neurological diseases. It goes to affects your heart by atherosclerosis. It goes to every part of your overall body organs and affect them individually, whatever the risk factor. I don't say it independently deals with it, but there are multiple risk factors, and gum disease is one of the risk factors. One of the risk factors. So you need to understand, like especially with diabetes, also it is one of the major risk factors which is accepted by the American Dental Diabetic Association and dental associations as well. So even in the case of neurological diseases also, there are evidences where gum disease can lead to contribution to the severity of Parkinson's and Alzheimer's disease. They don't cause independently, but they contribute to these diseases severity as and when the situation of the gum disease becomes worsened and the severity of the neurological diseases eventually fall into the later stages. Now, as I said, when you compare to health and disease, that when there is a diseased gums, when you have a severe typical type of a gum disease, it leads to a lot of bacteria and a lot of harmful substances which are released into your bloodstream, which may reach to your brain through the neurons, through the pathways, and cause some deficiencies or some issues into your neurological pathways, which can lead to this type of diseases or contribute to Parkinson's disease. I would like to give you one very excellent evidence from Neurology Journal, which says that maybe all of them who are using dentures know that sometimes with the dentures, we advise you something called as a denture cream, something like a denture powder, what you put on your denture and you wear a denture. That's basically for a good retention. And you will not believe that an unusual source of zinc is there in those denture creams or denture powders or denture adhesives, which is commonly called as. I'm talking about something like this. Now you can relate to me what I'm talking about. what you put on a denture and you wear when sometimes the denture is loose. Or maybe you feel psychologically, when I put this, it's like a glue which is going to give an adherence to my denture into your mouth, which will not fall off when you are talking or eating something. So this is a very important aspect to understand, that this could be a source of zinc, and zinc contributes to severity of Parkinson's disease. Understand that. When the zinc is more, it also leads to less copper, hypocuprimia and hyperzincemia. So when that happens, it worsens the Parkinson's disease. So this is something very interesting that caregivers should understand, that a denture cream should not contain zinc, or I advise zinc-free denture adhesives for neurodeficit patients. This is something very important to be noticed, which I'm sure most of them are unaware of. So that much of intricacies are there when these elements are important in causing the problem. One element I have discussed is zinc now. FDA in 2009 has done a very landmark statement. Maybe when you see this picture, you understand. What is this exactly? These are silver fillings. Conventionally in dentistry from long time, we used to do silver amalgam fillings. These are the silver fillings which are done, definitely very good quality of filling. They stay for a long time, maybe for life. They are very hard. They're very good fillings. But in today's modernized dentistry, do not advise to go for these silver fillings, because silver fillings have got to do something with mercury. So whenever we have a silver filling, it's called silver amalgam. You know what amalgam is? Amalgam is something when you mix metals with mercury. So it comes with a liquid mercury, and what is to be considered is the mercury content. Mercury is something which has to be considered here. Mercury, in this case, the FDA has opposed the use of silver dental fillings for Parkinson's patients. This also is something very, very important which has to be considered. For a patient, for a caregiver, and as well for a dentist, that do not go for silver amalgam fillings or a silver fillings in today's practice, because they are in a process that they need to use mercury, even though there are very stringent criteria and we use it with a very minimal mercury content, but then still the FDA opposes the use of silver filling, especially in Parkinson's patient, because the contribution of mercury has got the absolute neurotoxic effect. Neurotoxic means it's absolute toxic to your neurological system. So these are two very important things which are scientifically proven and evidence-based, which I wanted to start with and share with you all. Okay, now we start with some of the tips I would like to give to the caregivers regarding the oral hygiene and its maintenance. Okay. Now, yes, what do you basically advise to the caregivers to take care of that? Start giving the patients a long gripped brushes which has got a very soft bristles, maybe, so that the brush reaches the corner of the mouth, because the patients cannot have, because they have a motor incapability. There is a cognitive impairment and there's a motor deficit where the brush cannot, you can't hold your hand and go and brush the last wisdom tooth there, right? So use a longer handle grip brushes with soft bristles which can reach to every corner of your mouth, even to your back tooth. That is something important. Or else go for an electric toothbrush. Make sure that the individual brushes after every meal, or at least rinses with the normal water after every meal. You can go for a powered floss instead of a regular floss. You have a regular floss which are there, which I mentioned to you before, but then for these patients, we can go for a powered floss or maybe a water pick device. Water pick is something which is used for irrigation or flushing of the debris, the food debris, which is there between your bridges, below your dentures, between your teeth, and all those areas. Antimicrobial or antibacterial mouth rinses, because if the brushing efficiency is definitely compromised, so at least the mouthwash can reach all the areas of the mouth and clean and flush off the bacteria which is there, not only of your gums, but on your tongue, on your palate, on your cheeks, whatever the whole oral cavity. The whole oral cavity forms an ecosystem, right? Fluoride toothpaste, which is very important, and zinc-free denture adhesives, which is very important. Then this is an example of a powered floss. Mind you, I am not marketing for Oral-B. This is just a picture just to show you all that you can go for a powered floss. This is a powered floss where you press a button and it flosses between the teeth, so which makes easy for a patient who has got a motor deficit to do it, or even for a caregiver to do it. So caregiver can focus on these things, where we can advise for a longer handle brushes. Maybe you can have for a powered flosses. This is something which I was talking to you about, a water flosser or a water pick, where you have a tip. I'm going to show you what exactly it does and how exactly it functions. Then this is a electric toothbrush. You can go for an electric toothbrush. You know, what is an advantage of an electric toothbrush? You don't need a specific technique for it. You can just, it's a battery operated, just switch it off and it cleans the teeth. So ideally, we don't advise it for younger individuals or for the people who can actually do it manually. It is just for the people who actually cannot do it. We advise powered toothbrushes or electric toothbrushes. So more effective is something called as a water flosser or a water pick. So this is how it flushes. Can you see the interdental gaps? Can you see the flosser? You have a nozzle which flushes the water. It could be a water, it could be an antimicrobial solution which you can add up into the jar which is provided with the machine, and you can just press it off and flushes off, irrigates your interdental area, cleans your interdental area, makes it very, very clean and effective for you. This is something which is very, very helpful for patients and very easy for caregivers to do it. How a caregiver will do it, I will let you know. Last session, there were many people who wanted to know about water flosser, and as I committed, I wanted to show it this time, so I had to include this video for a better understanding. And then anyone who wants to procure this, just let me know. I'll just send you a link where exactly you can take it, because it's not available directly in the pharmacy places and all. So and when you go online, you have got hundreds of water flossers. So which exactly you're supposed to procure based upon your dental condition, we would advise you. So I am open for that. If anyone needs it, just let me know. I will guide you regarding that. So now these are few of the tips for the caregivers. Now I have already mentioned before that what caregivers are supposed to use for an easy method of oral hygiene. Now I will tell you how are they going to use, or how are they going to help the patients to clean. Now, if a patient is having natural teeth in their mouth, how will a caregiver help that patient? First thing, the caregiver always has to make sure that he or her has to stand behind the patient. You have to stand behind the patient and help the patient to brush the same way, so that patient feels like you stand behind the patient and you help the patient to brush, because the patient will feel, it will mimic the natural way of brushing. Not in front of the patient and you brush, behind the patient and you brush. Use the patient's strongest hand for brushing. Make the patient himself brush. Hold the patient's hand, go behind the patient and help her or help him to brush. Something very important. Make sure that the patient brushes, flosses with the way they actually, you assist them in doing it. If they are not able to do by themselves, then you have to do it. Maybe at that time you may have to come to the side, like what we call in dentistry as a 12 o'clock position, maybe a 9 o'clock position or a 6 o'clock position. And you help the patient to do it. And never throw the brush or maybe the floss sometimes, because it's disposable, don't flush it in the toilets. You have to make sure that the floss is rolled up and thrown in the dustbin separately. Make sure that is something important. Make sure you use a very soft brush. In this also, I can help you all to know which brand and which soft brushes, ultra soft brushes or sensitive brushes you can use based on patient specific. You can go for an electric toothbrushes also, and you have to make sure that the patient or even you using your force, don't put a double force and try to brush very hard, because the brush is soft, even though aggressive toothbrushing is not indicated for these patients. Because aggressive toothbrushing basically leads to something called as abrasion. That means you will worn out your enamel unnecessary because of an aggressive toothbrush or an aggressive toothpaste also. If you use a very high aggressive toothpaste also, make sure that a person rinses with warm water or a normal water at least after every meal. Okay.
Dr. Ashank, there was a question about the rinsing
Yes.
if they are unable to do it themselves.
Yeah. I will get. Yeah. I'm going to give you a very good tip about this in my next 2 slides. Like, if this is how someone can stand behind and you can help the patient to actually brush. When we move on to when a patient is wearing a complete denture. Now, when we are talking about these diseases, which mostly happens in an older life. So now patients are having some partial denture, someone has a complete denture, someone has like they don't have a natural teeth. Now, how will a patient do? First thing is, caregiver should learn from a dentist how to remove the denture, how to place the denture. It is not a patient. Patient may know, but patient may also guide. But you should know as a caregiver that how do you place the denture, and first you place an upper denture, then you place a lower denture. How do you remove a denture? How do you place a denture? It needs some practice, which healthcare dental professional is going to guide you and help you for that. Both the dentures, you have to remove them and you have to clean them. See, now there are two things which are very important. Whenever you are cleaning a denture, please be careful that wherever you are cleaning, make sure that the utensil or a sink should have water filled into it, because there are high chances that the denture may fall and they may break or crack. This is a tip or an idea for you. Or at least keep a towel below it, a wet towel below the denture. So there are most of the chances that when a denture drops down, it will not have cracks or fracture. Because if it cracks, again, the visits to dentist will increase, and again, you have to go for a new denture. So to avoid those things, which you can do it by yourself, is avoid cleaning it directly when you have an empty basin there or something like that. But then make sure that there's a water filled, or there is a towel, there's a wet towel, which doesn't allow the dentures to crack. Scrub the dentures with a denture brush or a soap. You have a denture brush and a soap, but mind you, we ask you not to use toothpaste for brushing your dentures. We have a denture cleanser solutions, or we have a denture cleanser tablets, soaps for brushing the dentures. Brush your dentures, both the dentures, all the surfaces of the denture, and clean the mouth, the jaws, the gums, because now there are no teeth, so you have gum pads, something what a newborn will have. Can you imagine the same thing? So you have to clean that, or sometimes you can use a denture cleanser, or maybe a warm water with half a spoon of vinegar even you can add and try to clean your dentures. If a denture has a metal clasp on it, because most of dentures have clasp, you can use a warm water only for soaking. So you have to make sure that dentures both the dentures are cleansed. When you remove the dentures, your mouth also has to be cleansed or cleaned. Your dentures have to be soaked overnight in a glass of water. They should never be left dry. You're supposed to soak the dentures in a glass of water the whole day and the whole night. And you're not supposed to wear it in the night. And the next day morning, clean your mouth, clean the dentures, wear it. So 2 times cleaning of mouth, 2 times cleaning of denture. Now your next question will be how, or I should say, why should we clean the mouth when you have no teeth? Or how should we clean the mouth when there are no teeth in the mouth? So it is not important because you're wearing denture and you are eating. So it is basically a second set of teeth which is given to you. And you need to maintain that itself and your mouth, because when you wear dentures, there are a lot of changes which happens into your mouth also, which has to be considered. So you need to make sure that also. Something like this. This is something very important. You clean this surface of the denture, because this surface of the denture is towards the tissue, is towards the mouth, what you're holding, wearing it. So this surface of the denture will have some plaque, will have some moisture. So this is a very important part of the denture which has to be cleansed, which mostly you only start cleaning the teeth because you are habituated to clean the teeth, but not the palate. But in this case, you need to make sure that this tissue surface of the denture is also well maintained, cleaned. And these are the steps which you need to do, that you clean the dentures in the morning and night, which I said. Use a mild liquid soap or a denture cleanser or something for cleaning, but not use a toothpaste. Brush all the surfaces of denture well, especially the inside, the tissue surface of the denture, which is the surface which is actually used, which is actually touching your oral cavity or your mouth. Clean the gums and tongue with a soft toothbrush, and make sure that you dip the dentures in a glass of water and maintain them. So you need to understand that all these aspects of maintenance of dentures are very, very important, and you should know as a caregiver how to manage the denture. Firstly, how to remove the denture from the mouth, how to place it back at the patient's comfort, clean them, maintain them, and clean the oral cavity also. Now comes how do you clean the tissues, the mouth. Now, when you have to also make sure, but first thing is the consent, that the patient should give you a consent that you can look into the patient's mouth. And what are you going to look into the patient's mouth? You will notice that the patients who are wearing dentures may have some changes in the mouth. You could see red patches, you could see white patches, you can see some swelling, you can see some below the lips where the denture extends, you may see some tissue, which is called as epulis fissuratum. You see bulk of tissue sometimes. When the denture irritates, there may be small abrasions because the denture may cut some area. So you need to look into it. And the moment you see such changes into the mouth, you have to report to the dentist. Now, the question is what Mr. Amin has asked me, that yes, when a patient is totally bedridden, how will the patient rinse? Yes, the answer is we cannot ask the patient to rinse. Now, there are two ways patient can rinse. Actually, if a patient can rinse closely to it, you need to get a kidney-shaped basin or a kidney-shaped dish where you keep near the patient's mouth and ask the patient to rinse into that. Or the same mouth rinse, what you can do is you can damp the cloth or a gauze piece or a cotton piece or a gauze piece into the antimicrobial solution, and you clean and massage the ridges or the gum pads of the individual, which is also almost the same. So this should help the patients, because every time maybe a patient, if a patient is bedridden but can slightly get up and then slightly rinse, then you can get the vessel near to the patient can rinse. But there are a lot of conditions, especially in Parkinson, because of the tremor, that the lack of muscular activity or an involuntary activity where patient cannot even do that, and they do drooling of the mouth rinse. At that point of time, you should make sure that you can use a dampened gauze with antimicrobial solution and clean the tissue surface of the area, which is very, very important for these type of patients. I'm talking about these types of lesions. What you can see these reddish patches which happens on the palate inside, because the denture is this also happens when someone is not removing the denture. This also happens when you are not cleaning the denture or not cleaning the ridges. Also, this happens. So this is also something which happens. That's why I'm telling you that you have to make sure that the mouth and the denture has to be clean, because this is basically, such patients are more prone to get fungal diseases into the mouth, because they are immunocompromised, because they are taking a lot of medications, and this is basically because the denture sore mouth. You get a sore mouth, you get ulcers, you get patches, and then till this resolve, we advise patients not to wear dentures. So now you can understand how difficult it is for patients for mastication or chewing. So these things have to be noticed, that are there any reddish patches, or there is a cottage cheese appearance, like something like curdled appearance of milk, something like that in the mouth, which shows candidiasis, fungal infections, ulcers. So we need to make sure that these things are noticed on a consent of the patient. A caregiver should make sure that you look into the mouth and report to the dentist. Don't just take a picture and send to a dentist. This is what I've noticed, and whether it is a pathology or it is a physiological change. And that has to be constantly kept under the guidance of the dentist. Next is, what are the materials which you can use, or a caregiver should make sure it is available when he or she is planning to take care of a patient. Should have protective gloves in hand. Lip lubrication is very important, something like a moisturizer or a petroleum jelly to apply all over the lip, because lip becomes dry because of a dry mouth, because of dehydration. A towel which you have to 100% make sure that the patient wears a small towel or a drape in front, because they're drooling of the rinse or of the foam, or all those things are there. Denture brushes, you should make sure that there's a liquid soap available, a soft bristle brush, a non-foaming toothpaste. A non-foaming toothpaste, because then the more and more the foam is there of a toothpaste, the more chances that the patient gets very difficult to spit around, very difficult to maintain. So we make sure that you have a less foaming or a non-foaming toothpaste. A mouth prop to keep the mouth open. There are different mouth props which are available, which are safety guards, and you need to understand from a dentist what type of mouth prop can be used and how to be used. Interdental, and then you should make sure that you have a set of interdental aids. You have got an electric brush, a powered flosser, a water pick, and a kidney basin, which I'll show you what exactly a kidney basin I'm talking about. So these things are minimum that you have to make sure that, depending upon the severity or a stage of the neurological disorder the patient is suffering from, what all materials can be in use for you to help the patient to maintain the oral hygiene. This is what I'm talking to you regarding the kidney basin, where you help the patient is able to spit immediately, sitting on the bed, patient can comfortably spit around. This is what is very portable, lightweight vessel what you can have, and patient can do it. Very, very mild nowadays. We have got non-foaming toothpastes available. Even for that, if anyone needs help, I can guide you what exactly or where exactly you can procure for it. Then you have something like this, which I told you. Patient can, you need to make sure that you drape a patient, you put a towel to a patient. Make sure that if a patient can get up, then you can put your mouth rinse beside, a brush, guide the patient, wear the gloves. Your protection is also important. And more than that, patient protection is also important, because there are the chances of cross-contamination. So that also has to be taken into consideration. So everything happens with asepsis, basic asepsis, which is necessary for the maintenance of the hygiene, and that has to be done, and patient can do it. Try to help and assist the patient to do it, or you have to do it. But then what are the things which should be made available is something which has to be considered. And these are the list of things which I said to you to be available for the maintenance of the patient. Then this is for the dentist. Like for the dentist, if you come across the patients of Parkinson or Alzheimer's disease in your clinic for the management, just a brief for the dentist. And you need to understand that how the first thing is you should be aware of what all things to be considered. And as a patient or as a caregiver, you should be aware of what medications the patient is taking. There should be a very good transparency between the caregiver and the dentist, so that the dentist understands the drug interactions, that the dentist understands the stage of the disease, what the patient is taking, because that is going to be very helpful for the dentist to proceed with the treatment plan comfortably and smoothly. So what are the easy tips for a dental healthcare profession? That first, make sure that for a dentist, that the whole dental office is aware that you're going to check a patient, consult a patient, or treat a patient with Parkinson's or Alzheimer's disease patient. Make sure that the staff makes the environment healthy and better for the individual. Schedule the appointment as short as possible, as early as possible. And as a caregiver, you should inform the dentist that if patient is taking MAO-B inhibitors. There's a group of drugs which patients are advised, because they have got a lot of interaction with the local anesthetics what is used in dental practice. So this is something very important for a dentist to know, and for a caregiver to know, that you need to give a thorough medical history of the patient. Patients may take antipsychotics, patient may take antidepressant, patient may take antihypertensive, patient may have dry mouth, patient may take so many things. As a dentist, you have to make sure that you consider replacing the old fillings. If there's a broken filling, if there's a fractured crown, if there's a whatever, try to correct the patient as early in stages of the disease than going late. Because as and when the patient's disease increases, the severity of the Parkinson's or Alzheimer's diseases, patient becomes absolutely incooperative, and it becomes very difficult for the patient to walk into your clinic and do a treatment. And as a dentist, you should be ready to do an in-house management also when time comes. So as a dentist also, and me being a dentist also, I would not mind to visit to a place and take care of a healthcare profession, as a healthcare professional, for a patient who is having so much of morbidity disorders that patient cannot walk into your clinic, and help to do minimally invasive or a non-surgical way of management of the problem of the patient. And dental visits may become very, very difficult for the patients as the disease progresses, because the stages increases, patient's cooperation falls down, the incapability, the motor inability becomes, the cognitive impairment increases, and becomes very difficult for the patient to understand, and very difficult for a caregiver to handle the patient in that way. So you need to make sure that as early you can manage the patient, try to correct the problem, go for preventive treatment. Patient has dry mouth, there are a lot of things which I could advise when you have dry mouth. We have artificial saliva substitutes, burning mouth syndrome. We have got so many things which can reduce the burning mouth of those patients. what denture creams to be advised, what floss has to be advised. Everything can be given and can be considered. But only thing is, we have to make sure that everyone in the dental office and everyone from the patient side or caregiver side should be aware of the history of the patient, the disease of the patient, and all the documentation has to be done properly. Understanding the dental risk is very important. That, as I said you before, that because of the motor and cognitive disturbances in these patients, it affects their hygiene maintenance and toothbrushing. Because these Parkinson patients alter the face and tongue muscle activity, it affects chewing also. You will not believe that it can also land up in swallowing problems. And when these patients have got a very high risk of getting aspiration pneumonia, they may get choking also. So even that has to be considered as a dentist. Gum disease, yes. So there are high chances of gum disease. If patients have got gum disease, you need to make sure that you treat the gum disease as minimally possible, as non-surgically possible, because the gum disease, as I said, has also a risk factor, increasing the chances of the severity of Parkinson and contributing to the severity of Parkinson. So you need to make sure that the gum disease is also corrected. The hygiene has to be maintained. And then lastly, some people with Parkinson's are taking immunosuppressing medication because they have got some other autoimmune problems. Some example, rheumatoid arthritis is there. Some patients may be taking clozapine. So these medicines will lead to immunosuppression. Patients may have less WBC, less platelets. So patient may have immunosuppression. So when patients has immunosuppression, what happens in the mouth? You get opportunistic infections. So you will see candidiasis in the patient's mouth. You will see gum disease in patient's mouth. So you need to also understand that why a patient is having these issues. And patient being in immunosuppressive drugs or an immunosuppressive condition will have so many other infections which are only because of that. So even that has to be taken care and prevention has to be taken care. So these are one of the most important aspects. In a brief, crisp way, I've tried to give tips to the caregivers and to my dental friends and colleagues that this is how we can manage these patients very comfortably, and it would be it would be a very important and integral part as a caregiver to understand the oral hygiene maintenance of patients and to understand that why exactly not only oral hygiene is maintained just for the sake of because it's a daily protocol of rinsing and brushing, but also the importance of oral hygiene affects and contributes to the disease is something very, very important for you to consider. So I conclude, and I really appreciate the caregivers who have been doing a lot, and really DOBARA also for appreciating and contributing so much for the caregivers and helping them so much, and motivating all the older adults of us who can actually live life comfortably like a normal person, maintaining their hygiene with themselves or the help of a caregiver. And we as a dentist are always a supportive team as a healthcare professional. We are always there. So thank you all, and thank you DOBARA for giving me the opportunity. I hope things are clear, and if anything else is there, I'm open for discussion and Q&A now. Thank you so much. Thank you.
Dr. Ashank, if you are okay with it, is it all right with you if on our website we share your practice information? So if anyone would like to contact you directly, they are able to. And then also we will open up our emails if anyone wants to send in any messages, ask any questions, because I think that water floss system is of great interest to a lot. So maybe we can do a little spotlight post on that.
We can actually have a briefing on water flossing, or maybe I could do a demonstration on it directly on the live.
Because I think the people who didn't watch the last week's session are wondering, is it only for caregivers? And in the chat, I put in that it's for anyone who is interested. So I think that will be of great interest to find out if you can buy it.
Discussion on water flosser about the types and indications, there's no contraindication, but the indications that everyone can get a little insight on it. I'll exactly focus on it maybe next time, or maybe a separate video on that, and then we can put on the website of DOBARA so that everyone is helped. It's basically for the humanity, and everyone, when it is available, not only a water flosser, there are about your powered flosses also, and about the electric brushes also. So what are the oral hygiene products which are replaced or which could be replaced for our geriatric population? We will focus on that, and then we can, and maybe because I cannot talk about one single brand because that's a copyright. So definitely I would be helpful, or maybe I will be glad to help individually if someone needs it, so that they can procure it.
That sounds like a very good plan. So if anyone does contact us, we'll share with
Yeah,
you.
sure.
And
Someone is near to us or someone is in India or Hyderabad, we even have customized brushes for some people. So I can also go for customization of some brushes depending upon the your teeth, depending upon the gaps between the teeth. There's a lot of stuff which I could help people. If so, whatever it is, I'm always there. So DOBARA, yes, for older friends of mine, but also for youngsters. Even they should be very aware because everyone has to fall into that part of life. So that is by nature, and everyone should take care of it.
that's, yeah, you're so right. It's so important. Our dental care is so intrinsic with our overall care.
Overall,
Um, and Dr. Ashank, will you also give us a little teaser of our next week's session so everyone is excited and looking forward to that one?
for the next, definitely. For the next week's session, we will actually focus on what are the changes in your mouth which happens with aging. As the age progresses, what are the changes in your teeth, changes in your gums, changes in your cheek, changes in your overall oral health, changes with aging? That is one part of the presentation. In that, again, the second part will be the most common. What are the changes which you see above that in diabetic people? Because that is something very common and almost present in most of the people from middle age nowadays. From even middle age, people are suffering from it. Even type 1 happens in something in children also. So diabetes and oral health changes, and how can we as a periodontist help to diagnose diabetes just seeing your gums? What are the changes what you notice with diabetes, and what are the special care to be taken, oral health tips for diabetic individuals? This is what will be the next session. So anything else has to be included with that, I'll be always glad to include even that also. So that is not a problem.
Perfect. Thank you. That sounds excellent. I will open up the email team@dobara.org. If anyone has any questions, we will share them with Dr. Ashank, and we look forward to seeing you next week, same day, Thursday at 6 p.m. India time.
Yes, fine. Thank you so much.
Thank you so much for taking the time out of your busy schedule. Oh, Mama Mateen Ansari wants to say something.
Yeah.
Dr. Ashank, I was particularly impressed by the list of equipment you mentioned for taking care of patients, because I have been dealing with some, and the kidney tray and the gloves and those minute details, that has really been very, very, and you've gone into such detail. I'm truly impressed and obliged for your help.
No issue, ma'am. It's always my pleasure because normally what happens is giving sitting at one position and giving oral hygiene tips is very easy. Anyone can sit and do and read and tell. But thing is, I wanted practically that everyone can do it at home. So that is why I thought it's better to give the list of things which you should actually be available at your home for every caregiver, so that you can actually practically start using it from tomorrow or today itself, in fact. Because that is why I wanted to. Maybe that list also we can update on the DOBARA website, especially,
Correct.
and who are genuinely taking consideration of this one as a caregiver, they can access that and they can directly reach on to me for exactly what is the patient's problem, and I could guide them what exactly or which brand they can procure.
Thank you.
We can-
Thank you very much, Dr. Ashank.
No problem, ma'am. It's always a
It's been
pleasure.
such a pleasure.
Always.
We admire you very much.
Thank you very much. Thank you very much.